Hyperthyroidism is a condition where the thyroid gland produces too much thyroid hormones, mainly T3 or 3-iodothyronine and T4 or thyroxine. This overstimulates the body's metabolism, and things start to speed up, sometimes a little too much. Now let's break down the key symptoms you will want to remember. The symptoms include increased metabolism, which leads to weight loss despite normal or increased appetite, then rapid heartbeat, tachycardia, palpitations or irregular heartbeat, then anxiety or irritability, tremors, usually in the hands, excessive sweating or heat intolerance, frequent bowel movements or diarrhea, fatigue or muscle weakness, sleep disturbances, goiter, which is enlarged thyroid gland, then menstrual changes with lighter or less frequent periods, fine brittle hair, and bulging eyes, especially in Graves' disease, which is a specific cause of hyperthyroidism. Now, hyperthyroidism can result from several underlying conditions, some autoimmune, some structural, and even iatrogenic. Now let's go through the main causes you will need to know. The first one, and the most common one, is Graves' disease. Graves' disease is an autoimmune disorder where the body produces antibodies called thyroid-stimulating immunoglobulins. These antibodies mimic TSH, which overstimulates the thyroid gland to produce too much T3 and T4. It often presents with diffuse goiter, exophthalmos or bulging eyes, and sometimes pretibial myxedema. Then we have toxic multinodular goiter or Plummer's disease. In this condition, multiple autonomously functioning thyroid nodules produce excess thyroid hormones, which are independent of TSH control. This condition is more common in older adults and may evolve from a long-standing goiter. Then we can have toxic adenoma, which is a single autonomously functioning nodule within the thyroid gland that secretes thyroid hormones on its own. Then we can have thyroiditis, which is inflammation of the thyroid gland. We can have subacute thyroiditis, which can cause leakage of stored thyroid hormones, leading to temporary hyperthyroidism. Other types include painless thyroiditis or silent thyroiditis and postpartum thyroiditis, both of which are usually self-limiting. Then thyroid hormone overdose, which occurs when someone intentionally or accidentally takes too much thyroid hormone medication, like levothyroxine. Okay, so those were the causes for hyperthyroidism. Now let's talk treatment options. These depend on the cause, severity, and patient factors. We have medications or antithyroid drugs like methimazole or propylthiouracil, which reduce hormone production. Then we have beta blockers such as propranolol that are used to control symptoms like tachycardia and tremors. Then we have radioactive iodine therapy that selectively destroys overactive thyroid tissue. It's effective but may lead to hypothyroidism, needing lifelong thyroid hormone replacement. Then we have surgery or thyroidectomy, partial or total thyroid removal, especially in cases with large goiters, suspicion of cancer, or in pregnancy where medications are unsafe. Then we have lifestyle and supportive care, where we have to encourage the patient for a high-calorie diet if weight loss is significant. We have to advise the patients to avoid stimulants like caffeine, And we have to mention the stress management because anxiety can worsen symptoms. And with that, we've come to an end. I hope that this video was helpful for you, and if yes, please make sure to like, share, and subscribe. Thank you for your time, and I hope to see you in the next video.